I think, Andy, for somebody that spent almost 20 years with two of the most successful and largest pharmaceutical companies that the world knows, and then transitioning into a growing biotech like Frontier, which is doing some phenomenal work, what two bits of advice would you share for any other leader in their career, whether they're in a larger company or a smaller organization, or they're an aspiring leader? What two bits of key advice have you picked up throughout this journey that you'd like to share and pass on to folks?
Yeah, happy to do so. Early in my career, I had a couple of very good mentors as well as sounding boards. What I had assembled was essentially, I would call my own personal board of directors. So when I had difficult, knotty problems thinking about, well, how can we drive this forward, one of the things that they shared with me early on was if you remain focused on the patient and do the right thing, you can make wonderful alignment in terms of thinking about, particularly when there's conflict, when there's misalignment from a collaboration partner, and as you think about not just in the business world, but when you think about some of the more successful molecules that have actually gone forward, both for early and unfortunately the AIDS crisis, as well as in oncology. Really, it was the regulatory agencies that were collaboration partners with the innovators. And how do you think about that from a collaboration mindset, but challenge where what you might think is the clearest, straightforward path might not be the one that actually optimizes for all those involved. The second piece, which is, besides being resolute on those patients, is thinking about at the end of the day, you know what's right, and particularly as a physician leader, in terms of thinking about with clarity, that you should never be afraid of taking bold statements that are actually for the benefit of patients. And I think that one of my mentors said it somewhat tongue-in-cheek, which is, Anna, you should never be afraid of being fired for doing the right thing, because that will help you in terms of advance and do very bold things as you go forward. But he said, every day when you wake up, as opposed to thinking about your to-do list, what you should do is ask yourself the question, how am I going to lead today? What are, of the 20 issues that we're trying to solve for, which ones are critical? Which ones do we actually need alignment on versus which ones can sort of fall by the wayside? And if you think about how you're going to lead, for me, the beauty of that then is you get higher team engagement, particularly with folks that you're trying to delegate some of the responsibility and autonomy and understanding and ownership to. And I would say, both at the time at Abbott and Astellas, as we drew the organizations and made changes for the organizations and grew them during quite turbulent external environments in particular, we are able to think about things not from a historical siloed transactional approach, but how could you actually do things that were more collaborative? And again, to me, if nobody remembers anything else from our conversation today, you can get a lot more done if you collaborate as opposed to think about it from a transactional perspective. And you can also get a lot of things done that you may have thought were impossible before or very challenging if you actually align folks and rally as to the why. And in particular, what we do in the industry is all about the patient.